All right, we're continuing this conversation with the Joint Health Sector Union. Johesu issuing an ultimatum, 15-day ultimatum to the government to address lingering issues concerning her members or risk another round of strike actions from the health sector. Well, we're having the studio to discuss this further. Comrade Chukwemeka Edwin or Hekiro, he is the immediate past public relations officer, Nigerian Union of Allied Health Professionals. Good morning, comrade.
Good morning.
Thank
Good
you for making
morning.
our time to join us.
Thank you very much for having me.
So you we'll take it that it's coming from the horse's mouth because you are a comrade in the union. Tell us what exactly is going on. Why the ultimatum? Why now? What is really going on? With Johesu.
Thank you very much. Johesu is a conglomerate of unions in the health sector. Four unions made up Johesu: the Nigerian Union of Allied Health Professionals, the Medical and Health Workers Union of Nigeria, the Senior Staff Association, and NASU. They are the people that make up Joint Health Sector Union in the health sector. So we have lingering issues. Some of them are decades now. For instance, the issue of CONHES adjustments. You know, in the health sector, there are two salary structures that exist. And the person that instituted those two salary structures was the late president, President Umaru Musa Yar'Adua. So there was a collective bargaining agreement when those two health salary structures were created. The CONHES, which takes care of the healthcare workers, and the CONMES, that takes care of the medical workers.
What could you explain for that? What do you mean
Okay,
by healthcare workers and medical workers?
CONMES is consolidated medical salary structure. That is for doctors. Then CONHES, consolidated health salary structures for other health workers in the system. So in the collective bargaining agreement of 2009, those two salary structures were like Siamese twins. And it was agreed that any adjustment on one will bring consequent adjustment on the other for there to be palpable peace in the health sector. You understand? But by 2014, the then president, Goodluck Ebele Jonathan, on 2nd of January, adjusted CONMES without consequence adjustment on CONHES. So those lingering issues started since 2014, the agitation, for there to be a consequent adjustment on CONHES. And CONMES has been adjusted since that 2014 for more than 3 or 4 times, with nothing done on CONHES salary structure. So it has been a lingering issue. He has had so many presidents that have come to discuss the issue and did not solve the problem. But the current government, President Bola Ahmed Tinubu, inherited a strike. We started a strike about May 17th, 2023, and by 6th or 5th of June 2023, our leaders met him personally in Aso Rock, and we discussed a whole lot of issues with him, and he promised that he will bring an end to it and requested that we'll call off the strike. I give him room to see that he does the needful. June 2015 till now is more than a year, and nothing has been done, even with the presidential assurances that he will put an end to this. And this has been a serious issue in the health sector. Because is a calling to help those that are sick. But it is difficult to perform those callings with empty stomach. The hardship in the health sector now is unimaginable. People hardly keep their families, people hardly maintain their families. Of course, the evidence is the exodus of health workers out of this country to places where they can afford better life. I can tell you comfortably, the kind of poverty amongst our members now, we have never seen before. People can no longer even take their kids to school. So we have demanded from federal government, we have met so many agreements, bargainings, and the rest of them. What we are now is at the implementation level. Discussions has been ongoing. We have met with so many committees. What we are now is at the implementation level. And we have watched government. They do not exercise the willpower to do this peacefully. And that is why we have issued 15 days ultimatum.
No, you've issued 15 days. How many days is left now?
It started counting on the 10th of October. Today is 12th. So they have 13 more days to do the needful.
So
Otherwise, we'll shut down. services.
So what is shut down actually?
Shut down services to shut down health services in all the federal health institutions for 7 days. Total shutdown. After which, if nothing is done, then it will be escalated to indefinite strike action.
All right, comrade, you mentioned something very striking. You said during the administration of President Goodluck Ebele Jonathan that the CONMES salary structure has been amended 3 times over without a corresponding amendment, on CONHES, right? What would you attribute the reason to that, increment without a commensurate increment on the other, salary structure? Would you say that it is political, or would you say it's just out of the president's goodwill to favor a particular, group of health professionals over and against the others?
I don't want to accuse any president, but it is sheer insensitivity on the plight of Nigerians. I've said it time out of count, that because our leaders do not patronize the health we provide in Nigeria, they are very insensitive to the plight of health workers who provide the services they do not patronize. So we only provide services for the common man. Every president goes to United Kingdom or France to go and take health care. Likewise, their ministers, the senators, and the rest of them. So they do not feel the pains of the people. So we are even using this opportunity to appeal to the public, to mount pressure on the government to do the needful, because they are the people that will suffer the brunt.
If they are insensitive as a
Yes.
government, what will make the unions think that they will respond to this?
Of course, they will that is why
Because they don't patronize your
yes,
services.
it is absurd that a government would allow the health of its citizens to deteriorate. It is absurd that a government, knowing fully well that the managers of the government do not patronize the health system, which we have always clamored for, that the reason why our education and our health is constantly going down is because the handlers of this nation are not patronizing it. Tell me, if you have any of your child in the public school, will you allow the roof of that public school not to be there? No, you won't. Because it is biting you. You have it right inside your house. But because most of them do not patronize that, they go to well-furnished places and the rest of them go to healthcare. Let me also inform you that most of those places they go outside the country to go and receive healthcare are the people we groom from these countries that are now working there. So what stops you from making the health situation in Nigeria, including the health workers and the infrastructure, better so that the people, Nigerians, can remain in Nigeria to work for Nigerians?
What you're telling us now that this is the root cause.
It is one of the root causes of the problem.
So
there could be other political and other things, which if we start discussing now, we might not have enough time to dish it out. But I'm telling you the key points. I believe that any sensitive government will have some indices it will want to adjust. These are infant mortality, life expectancy of Nigerians. If you do the needful, I understand government going around trying to bring up some policies to cut down, health workers. Those are flamboyant actions. The root cause is making sure that those that are working and are willing to work are provided for and incentivized in such a way that they will be capable and willing to render the services to Nigerians.
I'm glad you mentioned that. Than giving government the ultimatum.
No. See,
shouldn't there be strategies for unions to come together and propose a way forward in trying to cut the multi-headed hydra, get to the root cause, plug the root cause so that the outcome will be better?
You see, unions are doing enough to see that these hydra monsters are cut short, but we need to address specific issues. The issue of CONHES adjustment is specific. It is a product of collective bargaining agreements. That once you adjust this, you should adjust that. Okay? Having adjusted this, why haven't you adjusted that? Okay? Those other secondary issues that are making them be insensitive are aside. But the issue is adjust, and the figures have been worked out. We have passed through so many technical committees. We have, it is left for the Presidential Committee on Salaries to say implement.
Like you said, implementation.
Implementation is where we are now. And what we are calling on government is to issue the right circulars to National Salaries and Incomes and Wages Commission to implement. That's all. And they shelve these untold sufferings that will be added to the already, suffering public, because Nigerians are indeed passing through a lot now.
So apart from this payment, what other specific reasons are you guys pushing for?
Yeah, there are other issues. We have
Yes.
there are some of the approvals that we have gotten, like the consultant pharmacy cadre, that you go through a certain process and become a consultant in pharmacy, and it has not been implemented across board. There are other issues of regulatory agencies that they stopped paying their salaries for the past 8 months. They've not received a dime. These are part of the issues that we are asking government to address.
I read somewhere that even the COVID-19.
Yes, there are institutions that during COVID-19 of 2020, there are institutions that the COVID allowances, hazard allowances that were paid, they weren't paid. And they rendered those services during COVID-19. And we're saying, pay them.
All right. So how effective, in your own opinion, are strike actions in Nigeria? And then secondly, sorry to cut you short, and then secondly, in any event that this strike action or this ultimatum, goes full circle and there's a strike action and then you still do not get your demands, what other tools, do the unions have in their sleeves to, get the government to do the right thing?
It's very unfortunate that the only language government hears, I'm not just talking about this government, several Nigerian governments hears, is action, strike action. And you do not need to go to battle to record bloodshed before you do the needful. We've always been talking to governments. From 2014 to 2024 is 10 good years. And the particular demand that is now at the implementation level has not been implemented. It shows that government is not interested in it. But we as union will do what is legally right for us to do to pressure government to do the needful, and industrial action is one of them. So when we shut down services, definitely there will be pressure on the government.
Okay, so
and we are not strike mongers. We don't enjoy strike, because once you say what we do in the health sector is manage lives, and in the hospitals 99% is not acceptable, because that 1% that is left is somebody's life. So we do not enjoy down-tooling. It is out of pressure and frustration, where you see your worker being unable to cater for the family. Let me tell you a typical example of what happens now. In the health sector, most of our people, they drive their vehicles with their kids and go to the school of their kids for school run in the morning and park the car there. And now take public transport back to the hospital. After work or during the time they're supposed to pick their school, they will now take public transport back. So you see that the reason why they are even bringing out the vehicle is just for the kids. So is that the kind of mindset, the kind of, you want to render services to save life? Government should do better than that.
how can the public support or be a partaker of the union's cause?
Yes, there are good-spirited Nigerians who can also reach out to government. There are people government listen to. We have the traditional rulers. We have those at the grassroots who are going to bear the brunt. We have those people who have religious leaders. They have large number of followers who patronize the services we render.
Has there been active mobilization of these stakeholders?
Yeah.
Of course, this action is part of the mobilization. The reason why we are scattered in every media house is to mobilize them and tell them that this is what is coming up. That from the 25th of October, if government does not do the needful, you will no longer see us in the institutions to render health services, including emergencies.
All right, now you're an ex-official in Trade Union Congress,
Yes,
which is a mother union.
Yes.
So what's the relationship between Trade Union Congress and Johesu, and what kind of support is Trade Union Congress, lending to Johesu at this time?
The Trade Union Congress is doing everything possible to see that the actions of unions are also listened to. We have two labor centers in Nigeria, the
Yes.
NLC and the TUC. And members of our union are scattered in both NLC and TUC. So we've escalated these issues to them because they also need to know and push it to the president, that we actually disembarked from that, suspended the strike action because of the utterance of the president. He's the father of the nation. He said, go back, I'll do the needful. And we consider doing the needful a thing that should not take for 1 year, more than 1 year to do. Because every details have been worked out, the values have been worked out. What you need to do is to say implement. So what is stopping government from saying implement? Why will Nigerians go through this untold hardship? Go to the hospitals and see what is happening. I'm not talking about the cost of health services. You now have the money, but you cannot even afford the services. So you are now pushing Nigerians to go and patronize private healthcare that they cannot afford, that their financial grip cannot hold.
Well, has there been attempts by Johesu to reach the presidency to find out the reason behind the delay?
I told you that on 5th of June, 2023, just within the first week of the president in office, we met the president in Aso Rock live and direct.
Yes.
And he assured us. Ever since then, we have been reaching the presidency and his ministers through various correspondences, reminding them that this has not been done. And,
no feedback?
No feedback. That is why we are now using this medium to ensure that, we do not just get a feedback, we'll get the implementation done.
So, despite this ultimatum, the government has not reached out to communicate?
Not to my knowledge.
All right, let's go back to the basics. Why the ages of Johesu? Right? You said Johesu is made up of 4 unions.
Yes.
Why was that, amalgamation done, really? Because there's TUC, and these unions belong to the TUC and then to the NLC. Why not fight through TUC or NLC? Why coming together as Johesu? What's the mandate now?
You see, there are freedom of association, including freedom of unions associating with each other. And these are unions that work in the health sector. And we have common challenges, common destiny, you understand? And we decide to pool our strengths together to confront those our common challenges. And we find it an easy way, to get the listening ears of government. So that is the basic thing that brought Johesu. Johesu is not actually a union, but it's a conglomeration of unions that have come together with common intention, common purpose, common welfare issues to say, yes, we are now together. If we are giving action, we are giving action together, to see that our demands, our welfare packages that are supposed to be given to us by government are delivered and intact.
Given your antecedents as a group, are there some wins that have been recorded?
Yes, we've established so many wins. And mind you, Johesu is not just fighting for her members. Johesu is also fighting for the general public that patronizes our services. Without time out of count, insisted that government will do things that will make life easy for the general public. For instance, we've advocated that government should give subsidy in power to federal health institutions to enable the cost of services go down. Because, we don't have a viable health insurance in Nigeria. Nobody saves for ill health.
Does Johesu speak to health insurance too?
Of course. The health insurance is a government agency.
No, I mean, do they bring up strategies, maybe recommendations to government?
Time out of count. We've brought out strategies to ensure that we increase those that are covered in the health insurance. Because if you do this and, people can easily know that when they are ill, they have something to fall back on. People will not be that. Let me tell you, many people are not even coming up to the hospitals because they don't have the money. So the level of unreported cases, are because people do not have the wherewithal to even approach the gates of the hospital. When you know that you don't have even transport fare to go to the hospital, or you don't have the money to pay for card, so people will, resign to fate. And resigning to fate when you're sick is resigning to death. Because there is no remedy coming up.
Okay, so I'm sure a lot of people would say, okay, fine. Let's assume that the government listens and then they pay what they're supposed to do. What are we to expect from the healthcare sector?
An energized health force, an enthusiastic health force, a health force that will no longer be dreaming about, leaving the shores of Nigeria, a health force that will want to work for their own citizens. You understand? We are always depressed to see that people who leave the shores of this country, that we are trained together, are doing very well outside the country in terms of rendering services And our leaders that are supposed to make here very conducive are going over there to patronize them. We want a situation where Nigerian health workers will work for Nigerians.
All right, very quickly before we let you go, because time is gradually winding down. Would you attribute this particular predicament of other healthcare professionals to the fact that most of them are not really politically out there? What I mean is, you don't find many health care professionals in political positions. Would you attribute that to the reason or the reasons as to why this particular policy has not been implemented?
Beyond just health workers being in politics, I will attribute it to the insensitivity or the lack of knowledge of the people that are there. Because everybody must not be a politician. You understand? There are people who are, there is a
But you do realize,
division of law, division
you
of
do
labor and
realize
specialization.
that there are more medical doctors in politics than any other healthcare professional.
I agree with you.
Okay.
But there are some level of selflessness that should go with leadership. I should not, be focusing on my family to make my family better because I am in power. No. Everybody now is part of my family. I recall the other President Muhammadu Buhari saying, I belong to nobody.
Yes, I belong to everybody.
I belong to everybody. That should be the mantra, the slogan, to show that it is a selfless service you've been called to render. You should be aware that the health workforce is a team. You cannot even go to the theater to operate without the cleaner doing the needful.
That's true.
And if you try that, the patient will go down. Because it's a septic area. So it's a team. And you, the surgeon, cannot go down to do that and still do the procedures. So it is a teamwork. Everybody has its own role. So any leader, any political leader should understand that framework and be able to see that we continue to move as a team.
All right.
So you cannot be the goalkeeper and the attacker at the same time.
True. Thank you so much.
So I will leave this notice, 15 days notice with you.
Okay.
A copy of it so that you also read through and see what we are demanding, our legitimate demands, and how governments over the years, with all the correspondence we've given them, have not responded since the past 10 years.
Absolutely. We'll go through it and we will inform our video viewers. Thank you so much, Comrade Edwin. Always a pleasure to have you sit here and discuss.
Thank you very much.
Thank you so much for your insight. All right, Abuja Rebounds comes up next right after this timeout. Don't go anywhere.